Welcome to today's Deep Dive. I'm your host, and with me is our resident expert. And, today's stack of sources is just a fascinating mix.
Yeah, it's a wild ride. We've got medical clinic blogs, intense post-operative care guides, and even a facial plastic surgeon's actual price list.
Right, because our mission today is to demystify this booming, incredibly complex world of advanced skin rejuvenation for you. We're moving past the marketing buzzwords.
Definitely. We want to understand what these lasers, needles, and devices are actually doing to human tissue.
And look, some of this science borders on science fiction. It's wild. But you are here to keep us grounded, decode the jargon, and, explain why you, the listener, should even care about any of this.
I'll certainly do my best. It's an exciting topic for sure.
So, I was thinking about this, like renovating a house. There's a logical order, right? You don't just start painting the living room walls if the foundation is sinking and the wooden framing is rotting.
Right, you'd never do that.
You have to go deep. You fix the concrete, rebuild the studs, and then worry about the surface aesthetics. But for decades, we've treated the human face by basically just painting the drywall.
We really have. And modern aesthetic medicine has finally realized that the foundation is actually sinking. And, the biggest, stealthiest culprit behind that sinking foundation is actually menopause.
Okay, let's unpack this. Why menopause?
Well, it's a profound systemic shift. When a woman goes through menopause, estrogen levels plummet. And estrogen essentially acts as the master conductor for skin health.
Meaning it controls everything else.
Pretty much. It binds to receptors that stimulate the production of hyaluronic acid, sebum, and collagen. So when that conductor leaves the stage, the skin's production line just grinds to a halt.
So the tissue gets dry and fragile. But the sources show it goes way deeper than just the skin, right?
Oh, absolutely. This is the surprising part. 3D imaging studies are showing that women actually lose bone density in their jaw and chin.
Like, really? The skeletal structure itself is eroding.
Yeah. Your skeleton is constantly remodeling. You have osteoblasts building bone and osteoclasts breaking it down. Estrogen normally keeps those osteoclasts in check.
So without estrogen, the breakdown outpaces the building.
Exactly. The maxilla, which is the upper jaw, and the mandible physically recede. The scaffolding holding the skin up retreats, so the face literally shrinks beneath the skin. That's what drastically worsens the appearance of jowls.
Wow. And hormone replacement therapy helps, but it's not a magic cure-all for that structural loss.
Right. It can mitigate some systemic decline, but it can't fully replace the dense structural loss in those early postmenopausal years.
And right alongside that, we're seeing a totally modern phenomenon causing a very similar structural collapse.
Yeah.
The medical community is calling it Ozempic face.
Yes, the rapid weight loss from GLP-1 medications.
To me, it sounds exactly like letting the air out of a balloon too quickly. The rubber gets loose and wrinkled.
That's a great analogy. When you lose 50 pounds over a few years, your skin has time to slowly contract. But on a GLP-1, you lose it in a matter of months. You aren't just losing belly fat, you're rapidly depleting the deep structural fat pads of the face.
Which leaves you with hollow temples, deep smile lines, and that sagging neck. So I have to ask, if the actual bone and fat foundation is shrinking, do surface creams even matter at this point?
Well, if we connect this to the bigger picture, a surface cream is just the protective paint on the house. It maintains the barrier, but true rejuvenation requires addressing that structural loss first.
So we have to work from the deep foundation up to the superficial layers.
Exactly. And the first line of defense is addressing muscle movement and deep volume beneath the skin.
Right, managing the mechanics. With muscle mechanics, everyone knows Botox.
Yeah.
But the sources highlight Dysport as becoming incredibly prominent.
Yeah, both Botox and Dysport use botulinum toxin type A to block nerve signals to muscles. But Dysport has smaller proteins.
Okay, so if we go back to painting, is Dysport kind of like a watercolor wash that blends out, while Botox is like a fine-tip pen for tiny details?
That perfectly captures it, actually. Because Dysport's molecules are smaller, it spreads more easily across large areas like the forehead.
And it acts faster, right?
Yeah, usually 24 to 48 hours versus 3 to 7 days for Botox. It's also highly effective for patients who have developed a resistance to Botox over the years.
But speaking of fine-tip pen details, there's a very targeted fix called Jelly Roll Botox, which sounds hilarious, but what is it?
It refers to treating the orbicularis oculi, the muscle right under the eye. In some people, the lower portion thickens. When they smile, it bunches up and creates a distinct bulge under the lashes.
Oh, so it's not crow's feet on the sides.
No, distinctly different. By placing a tiny unit of toxin right beneath the lash line, you relax just that band of muscle. It stops the under eye from getting puffy when you smile.
Fascinating. So that handles the pulling muscles. But what about the missing volume from the shrinking bone and fat?
That's where biostimulators come in, like Sculptra and Radius. Traditional fillers just sit there like a gel pillow. Biostimulators are completely different.
Because they actually provoke the body, right?
Exactly. Sculptra is made of polylactic acid microparticles. When injected, the immune system sees it as a foreign material. Macrophages, the cleanup cells, rush in.
So it causes localized inflammation on purpose.
Yes, a subclinical inflammatory cascade that signals your fibroblasts to pump out massive amounts of dense structural type 1 collagen to wall off those particles.
That is incredible. And then the particles dissolve.
Over several months, they dissolve completely, leaving behind your own newly synthesized collagen, which is why the volume lasts 2 years or more.
And then Radius gives you immediate structure, acting as a scaffold while also stimulating collagen. The source even mentioned mixing it with PRP.
Yeah, platelet-rich plasma from your own blood. When fanned under thin, creepy skin on the neck or chest, it rebuilds the tissue network without making it look overfilled.
It really highlights a core belief here. Aesthetic medicine works best when it forces the body to heal itself.
Precisely. We are just giving it the tools.
Right, so the foundation is stabilized. Now we have to address the quality of the actual skin surface, the drywall. Which brings us to lasers.
Right. And lasers range from a mild sunburn to an intense medical ordeal.
Let's start mild. Non-ablative lasers like Fractional Dual or Moxie.
These heat the dermis to stimulate collagen without breaking the skin's surface. You might be pink for a day, but there's virtually no downtime. The results are gradual and subtle.
But if you have severe sun damage or deep acne scars, you have to bring out the heavy hitter, the fractional CO2 laser.
The ablative CO2 laser is the aggressive gold standard. It uses highly focused light energy that instantly boils the water inside your skin cells. It literally vaporizes the outer layer of skin.
Here's where it gets really interesting. I read the post-care instructions, and they are intense.
It's essentially trauma care. The face is raw, swollen, and oozes a yellowish fluid called fibrin.
Wait, oozing fibrin? The skin crusts and scales, and you have to do vinegar and saline soaks every 2 to 3 hours?
Yes. Because the skin barrier is gone, you're vulnerable to infection. The white vinegar temporarily lowers the skin's pH, creating an acidic environment that pathogens hate. Then you top it with Vaseline.
For like 14 days of downtime. And the skin can stay pink for a year.
Yeah.
Why on earth do people volunteer for this?
Because the body's trauma response is the medicine. When you deeply burn the dermis, the body reacts as if it's a life-threatening injury. It replaces disorganized, wrinkled tissue with incredibly dense, highly organized collagen.
So it's basically flawless regeneration. But the industry has been desperately searching for a way to get CO2 results without the nightmare recovery, right?
Exactly. And that desperate search led to the latest breakthrough in our sources, the UltraClear Laser.
Okay, the UltraClear 2910 nanometer laser. It's billed as the world's first cold fiber mid-infrared laser. Sounds contradictory. How is a laser vaporizing tissue cold?
It comes down to thermal spread. A traditional CO2 laser vaporizes a cell, but the heat radiates into adjacent healthy tissue. That heat causes the massive inflammation and the prolonged redness.
The collateral damage.
Right. But the UltraClear's specific wavelength hits the peak of water absorption. It delivers energy so fast that the target cell vaporizes before any heat can conduct to the surrounding tissue.
So it deletes the cell but severely limits the heat damage around it.
Yes, which means downtime drops from 14 days to just 2 to 5 days.
That's a massive difference. And crucially, because it doesn't cause that massive heat inflammation, it's actually safe for darker skin tones.
This is huge. CO2 lasers can trigger melanocytes to hyperproduce pigment, causing severe hyperpigmentation in darker skin. UltraClear's cold ablation avoids that completely.
But the most mind-blowing part to me is laser coring, instead of just burning the surface.
It literally hole punches 350 to 400 micrometer cylinders straight through the skin.
We are literally hole punching the human face. It sounds like aerating a lawn so the grass grows back tighter.
What's fascinating here is how this exploits a microscopic loophole in human biology.
A loophole?
Yeah. Usually, a deep cut heals with scar tissue. But tissue engineers found that if an injury is under 500 micrometers, the body heals it perfectly with normal tissue, avoiding scar tissue entirely.
Because it's so tiny, the surrounding cells just jump across and patch it before the scar pathway triggers.
Exactly. And as thousands of these microscopic holes collapse and heal, the skin physically shrinks and tightens. You're doing true scarless skin removal.
And CO2 can't do this because its heat damage would push the injury zone past that 500 micrometer limit,
Yeah.
leaving you with tiny white scars everywhere.
Spot on. But as miraculous as laser coring is, there is a physical limit to what lasers can shrink.
Right, gravity always wins eventually. When aging outpaces the lasers, we're looking at surgical intervention.
The first step is something like smart lipo, which is a bridge between lasers and surgery.
This is where they put a laser under the skin.
Yes, it physically melts fat deposits, like double chins, while simultaneously heating the skin from the inside out to make it contract.
The inside-out approach. But what happens when severe Ozempic face or advanced aging hits? Then we are talking deep plane facelifts.
Yes, surgeons like Dr. Chip Cole use this technique. The old way was just pulling the skin tight like a wind tunnel. Now they go deep. They release the facial ligaments, reposition the heavy tissue, and reset those ligaments.
Without visible scars, because the deep muscles are taking all the tension, not the skin.
Exactly. But it comes at a steep price. A deep, plain face and neck lift easily starts at $25,000. And that's before add-ons like an $8,000 lip lift.
Wow. So what does this all mean? We've gone from shrinking jawbones to biostimulators, weeping CO2 burns, microscopic lawn aeration for the face, and 25 grand surgeries. We aren't just pulling skin tight anymore. We're architecturally rebuilding the face.
That's the real takeaway. Whether it's biostimulators, cold lasers, or ligament-level surgery, modern aesthetics is entirely focused on cooperating with the body's natural regenerative mechanics rather than fighting them.
It's incredible. And for you listening, I know the sheer volume of information can be overwhelming. But understanding these mechanisms, how heat, trauma, and healing interact, makes you infinitely more informed than just reading a spa menu.
Absolutely. And it leaves us with a highly provocative thought. If our laser technology is now precise enough to trick the skin into flawlessly regenerating itself on a microscopic level without scarring,
Yeah.
how long will it be before these exact same aesthetic technologies are adapted to heal major traumatic injuries, severe burns, or even regenerate failing internal organs?
Man, that is a wild thought to end on. The line between cosmetic enhancement and regenerative medicine is just disappearing. Well, thank you for joining us on this deep dive into the true architecture of the skin. Keep questioning the science behind the surface. We'll see you next time.